Okay, you've got the list of players' names and their contact numbers. You've got the jumpers, footballs, magnetic board. Can't coach a women's football team without a magnetic board. First aid kit?
Oh, yeah, just on that matter. I'm okay with the training drills and the coaching strategies and the administrative stuff, but I am a bit concerned I don't know enough about sports injuries. I mean, what happens if somebody gets injured during a game or a practice?
Oh, no problem. Your assistant, Lisa, is trained in sports first aid. But basically you need to remember it's AAA.
AAA?
AAA, all about acronyms. Look after your Dr. ABC, then when that's taken care of, it's into your SOLTAPs. RICEs for soft tissue injury, no harm of course, and just keep an eye out for DOMS.
Oh, I see. Okay, do you mind taking me through all those?
Easy. Just come inside to the whiteboard.
Correct prevention strategies, treatment and rehabilitation are all vital for anyone who sustains an injury while playing sport. This program is about sports injuries. We'll look at strategies for preventing them, causes and types of sports injuries, immediate and further assessment, treatment of soft tissue injuries, and injury rehabilitation. Many injuries in sport are preventable, and there are a number of precautions that can help athletes avoid them. One of them is a suitable warm-up before playing.
So by making sure the team does a proper warm-up, certain injuries can be avoided?
Correct.
So what should be included in the warm-up?
Usually around 10 minutes of light continuous exercise, and it should be specific to the sport. Here, listen to this.
A fast sporting skill like a tennis or squash or football or one of these sports that involves speed, then I think warm-up is critical both for injury prevention and for skill and for performance. I think if the sport is relatively slow, for example like jogging, recreational jogging, that in itself can be a warm-up activity, so there probably isn't a great necessity to warm up prior to it. If you are a sprinter, you would never anticipate a maximal effort speed activity like that without a substantial warm-up to prepare the muscles for the type of speed of contractions they're going to do. So, I suppose the worst case scenario is a muscle or tendon rupture because the muscle wasn't sufficiently prepared for the activity. I think the general principles of a warm-up are that you try to mimic some of the sporting skills, and you try to focus on body parts that are involved in the sport.
To play sport at any level requires a good base level of fitness. Training programs should assist athletes to develop both fitness and skills to equip them properly to participate in their chosen sports. A combination of strength and flexibility is important in developing appropriate fitness levels. Insufficient training can lead to injury, as can overtraining.
Insufficient training is a big issue for people at all different sporting levels. Each sport has very specific requirements in terms of the physical preparation. If there hasn't been sufficient time given for the athlete to prepare, then that can certainly cause issues regards injuries. Overtraining is common. Overtraining is common at all levels of sport. I observe it frequently at the elite level of sport and also with recreational sports people as well. Some of it comes from ignorance and on their behalf and a lack of guidance perhaps from coaches and parents. Some of it comes though from the athlete themselves and through a burning desire to improve. Their training loads become unrealistic and therefore they're putting themselves at risk. So in either scenario, overtraining is an issue for creating injury.
Warming up helps prevent sports injuries, especially for sports requiring high-speed movement. The warm-up should duplicate movements of the sport. Avoid injury by training with the correct type and level of intensity for the sport. Overtraining can cause injuries. By eating a balanced diet, the body gets the nutrition needed to help it ward off injury and illness. Maintaining fluid intake while involved in sport is critical. Dehydration can decrease stamina and reduce an athlete's capacity to make judgments, perform skills and movements. And these can all increase the incidence of injury while playing sport.
So there's a lot players can do to assist them to avoid sports injuries.
Yes, but don't underestimate your role in helping to prevent injury too.
Me? How can I help them avoid injuries?
Oh, a lot. You can encourage players to wear protective equipment when they're playing sport and to always play by the rules, because rules are there to protect players.
What else?
You have to make sure players know about the risks they face when playing sport, and you must ensure that players are well trained. Here, have a look at this.
There's a lot of ways in which a coach will impact on the injury profile of his or her team. They may underestimate or overestimate perhaps the ability of their squad to cope with a level of training and pitch the level of training too high. The level of the training may be appropriate, but they simply do too much of it. So the coach needs, I feel, some sympathy towards coaches who these days are expected to be experts in all things, both technically in their sport and also trying to manage the training loads of their teams. You know, they are a critical part of the injury prevention of a team, and hopefully the health professionals who work with sporting teams also have good relationships with their coaches and can coordinate that well together.
Two key elements to preventing sports injuries are wearing appropriate protective equipment and maintaining the condition of playing surfaces.
Protective equipment is a very important part of some sports, not so critical in others. Mouth guards in football, I can't think of a reason why you wouldn't choose not to have one. In some sports it isn't an issue because it isn't given as an option perhaps. You know, if you're going to be involved in a cycling event, you'll wear a helmet because that is the consensus and the norm for that sport. It's in sports perhaps where the kids get a choice of whether they would like to wear something or not wear something, where it becomes a bit more grey. But I think another important thing about protective equipment, regardless of the sport that you play, is that it's comfortable and it's doing the job that it's meant to do. If the sporting equipment is not comfortable, then obviously athletes will be reticent to use them, and they should be of a good quality and well fitting so that they're providing the protection that they're designed to do. I think it's well documented that if a surface is uneven or inconsistent, that can cause the athlete to have uncertainty as to how the surface is going to respond beneath them. Playing surface, its consistency and its quality is very important for athletes.
A suitable diet can help prevent injury. During activity, fluid intake prevents dehydration. Quality of coaching impacts on potential for injury. Protective equipment should be worn if needed. It should be comfortable to wear. A poor quality playing surface can also increase the risk of injuries. Minor sports injuries include small bruises and cuts, stitches, cramps, slight muscle strains, minor blisters and general soreness. Major injuries include concussion, soft tissue injuries like cartilage damage, ligament sprains and muscle and tendon tears. Also, dislocations, fractures, loss of consciousness, spinal injuries, even heart attacks and strokes can be suffered while playing sport.
I don't think there's a precise definition for severe and not so severe. I know that in sports medicine we use a common rating system for a lot of soft tissue injuries, grade 1, 2 and 3, which is helpful, but we need to, I think, recognise that all injuries are a continuum between no injury and obviously the far more severe ones.
Broadly speaking, there are two main causes of sports injuries: external violence and internal violence.
Internal violence refers to an injury that involves a breakdown of a tissue in the body, so there hasn't been necessarily an external force applied. External violence we associate, of course, with our collision sports, where there's a collision and it results in damage to a muscle and internal bleeding, or a broken bone, by a collision.
So I've just put some pressure.
There are three main categories of internal violence injuries. These are acute injuries, chronic injuries and overuse injuries.
Acute injuries refer to injuries that occur with a rapid onset and usually from a single incident. That's what we refer to as acute injuries. So if one has had no prior recent history of, for example, a muscle tear in the thigh, and then you try to run fast and there's a breakdown of that muscle as you're running, that's referred to as an acute injury. A chronic injury, on the other hand, refers to an injury which lasts over a long period of time, may not necessarily respond to rest, and usually is not necessarily from a single acute episode. Overuse, on the other hand, is an injury which has developed over a period of time from repeated stress and repeated trauma. So there's not necessarily been one specific incident, but a whole series of incidents or prolonged stress to a part which causes it to break down.
Asthma is a respiratory condition caused by excess mucus in the airways. Asthma can be induced by exercise, and asthmatics need to take extreme care when involved in playing sport. Delayed onset muscle soreness, or DOMS, is muscle discomfort which often occurs after activity.
Delayed onset muscle soreness is the soreness that you have when you do an inappropriate level of exercise that your body's not accustomed to. If I went to the gymnasium and I did 5 sets of 10 heavy bench press tomorrow, or any other exercise for that matter, I would wake up the next day with significant muscle tightness and soreness. And there hasn't necessarily been a great deal of trauma within the muscle on a large scale, but microscopically there has been some trauma, and that causes soreness that is delayed in onset. At the time of doing the exercise, the athlete's doing it with reasonable comfort, but the second and third day afterwards can be very painful.
Sports injuries can be major or minor. Injuries can be caused by external violence where a collision takes place, or by internal violence where no collision takes place. Delayed onset muscle soreness is where the muscles experience soreness a day or two after the activity rather than during it.
So who's this Dr. ABC person then?
Dr. ABC? Acronyms, remember? It's the very first thing you should check, especially if the injured person is unconscious.
So what does it mean?
Here, look at this.
In any first aid situation, remember Dr. ABC. D for danger, R for response, A for airway, B for breathing, and C for circulation.
Dr. ABC is a very helpful tool for people involved in sports medicine to help them approach a first aid situation in an appropriate way. And the D stands for danger. So that means that before one approaches an injured player, an injury situation, one considers first of all safety to themselves. In terms of exposure to blood or exposure to a footballer who is lost some control and who might hurt them, those sorts of things need to be considered first.
Hey Jane, you all right?
Response can be done by talking to the person, by trying to elicit some response to a stimulus such as a touch of the hand or a tap on the shoulder or the face or something like that. A, of course, stands for airway, and that is the first of the more critical parts of your initial assessment or your primary screening of an injured person, to make sure that there is nothing occluding the airway and preventing the person from breathing. So without going into the details of how that's done, one quickly makes sure that there's not a mouth guard or dentures or the tongue blocking the airway and preventing that person from having a normal ventilation. Breathing is assessed using all of the senses. You look, listen and feel to see whether the athlete is breathing, and not only whether they're breathing but also the quality of the breathing. One tries to make a quick analysis of whether the athlete's breathing freely or they're laboured or there's some blockage to their airways. And the last of the Dr. ABC is circulation, and usually in the sporting sense one can visually see any blood or open wounds, and one can get a quick impression of the overall circulation status of the patient by looking at the colour of their skin.
For immediate assessment of an injury, remember Dr. ABC: danger, response, airway, breathing and circulation.
Now, there was another one you mentioned, something to do with TAPS?
SALTAPS. SALTAPS. And it's got nothing to do with TAPS.
Go on, lay it on me.
Dr. ABC is your initial primary screen, if you want to call it that, and then your secondary screening or secondary assessment as a first aider is done using a SALTAPS type approach. The first of them is to stop and take a breath and just assess your own safety and the safety of the athlete and just the situation in general, so you're sort of calm to make good decisions. Ask is the second letter in SALTAPS, and simply means one asks the athlete what happened.
You all right?
Yeah.
What happened?
One asks perhaps bystanders or parents if it's necessary, so you can get a good clear picture as to what's gone on. L stands for look. You're encouraged to again take your time and look for anything that might be relevant to your information about the injury. So one looks for bleeding, bruising, scratches on the skin in a contact sport. T stands for touch. T is touching obviously gives you some valuable information. If one has a sharp pain response from touching an injured area, that's a good indication that something's gone on.
You move your
active movement, similarly, you encourage an injured person to move the injured part and ask them quite simply, can they move it? And if they can, once again, that may give you an indication of the degree or the severity of the injury. Passive movement, on the other hand, is done by the first aider or by the therapist. So having asked the athlete can they move, then one tries to do it for them, and again that gives you further information about whether you might be dealing with a soft tissue injury or a fracture or something more sinister. The last letter of SALTAPS refers to stand up, and that simply means that having done a screening of the athlete in terms of can they move and can you move the part and so forth, your assessment might be that all of those things are reasonable, and you'll attempt to stand them up and see how they go. If an injured athlete can't move the body part themselves, one has to be careful not to conclude from that the injury is necessarily severe. It may be that they're fearful and scared of moving the injured part, and in fact the degree of the injury is not so bad. But of course it can be to the contrary as well.
For further injury assessment, remember SALTAPS. Stop, ask, look, touch, active movement, passive movement, stand up.